Here's something that honestly surprised me when I first looked into this. There are 11 million Americans right now with diabetes, and they have no idea. Not because they're ignoring it, because the signs don't look like what you expect.
No dramatic symptoms, no obvious warning, just small things on your skin, your hands, your feet. Things most people write off as nothing.
And here's the thing. I went through the research, the clinical data, the case reports, and what I found is that a lot of these signs show up years before an actual diagnosis. So in this video, I'm going to walk you through 10 signs of diabetes you can actually see right now on your own body. Some of these you can check while you're watching this. So let's get into it. So what actually is diabetes? Here's a short version. Your body runs on glucose, basically sugar.
And there's a hormone called insulin that acts like a key. It opens in type 2 diabetes, which is what we're focusing on today. That key stops working. Your cells stop responding to insulin, so glucose just stays in your blood, builds up, and over time, that excess sugar starts damaging things. Blood vessels, nerves, organs.
And here's the thing, that damage doesn't announce itself. It's quiet, slow, which is exactly why so many people miss it. Before we get into the signs, let me tell you how this actually gets confirmed. Because this matters.
The test is called a hemoglobin A1C, and it's more useful than a regular blood sugar test. Here's why.
Your red blood cells live about 2 to 3 months. During that time, sugar in your blood attacks to them, a process called glycosylation. The more sugar, the more it sticks.
So the A1C test tells you your average blood sugar over the past 3 months, not just a snapshot from this morning. A full picture, a result of 6.5 or higher, that's diabetes. Between 5.7 and 6.4, that's prediabetes. And that's actually where most people are sitting without knowing it.
The American Diabetes Association recommends getting tests starting at age 35. But if you have any of the signs we're about to cover, don't wait. Okay, first signs. And this one is something a lot of people dismiss. Waking up at night to use the bathroom once, maybe twice, and thinking nothing of it.
Here's what's actually happening. When blood sugar gets too high, your kidneys work overtime trying to filter it out. At a certain point, they can't keep up. So excess glucose spills into your urine and it pulls water with it. More urination, more dehydration, more thirst.
And then people reach for juice or soda or hydrate, which adds more sugar, which makes everything worse. The specific thing to watch for, waking up more than once a night consistently, that's the pattern that matters. This one gets missed constantly, and I think it's because it's easy to explain away.
You eat a full meal and an hour later you're starving again, or you're exhausted by 2 p.m. even after a full night's sleep. Here's what's actually happening. Remember, in insulin resistance, glucose can't get into your cells properly. So even though there's sugar in your blood, your cells are literally starving. They're not getting fuel.
Your brain responds to that by sending hunger signals. Eat more. Get more energy. But the root problem isn't food. It's that the glucose can't be used.
Some people call this food noise now. That constant, distracting hunger that doesn't go away. The research backs this up. It's a real physiological signal, not a willpower issue. Combined with fatigue, this pattern is worth paying attention to.
Now, grab a mirror if you have one nearby.
Look at the back of your neck, your armpits, your groin area. If you see dark, velvety patches of skin, thicker than the surrounding area, kind of like velvet fabric that has a name, it's called Acanthosis nigricans. Here's what it means. When your body becomes insulin resistant, your pancreas compensates by pumping out more insulin.
And here's the interesting part, that excess insulin binds to receptors in your skin. It triggers skin cells to overgrow, especially in area with fission.
The result is that dark, thickened appearance. Now, important note, this isn't dirt. It doesn't scrub off, and it's not a skin condition on its own. It's a signal from the inside. Research shows that in children with Acanthosis nigricans, about 62% had measurable insulin resistance. It's one of the earliest visible markers we have. While you have that mirror, check the same areas: neck, armpits, groin. Skin tags are those small, soft flaps of skin that hang off the surface. Most people have one or two and think nothing of it. But here's the thing, having multiple skin tags, especially clustered in those same friction areas, is associated with insulin resistance. Same mechanism as Acanthosis nigricans. Excess insulin stimulating abnormal skin cell growth. One skin tag, probably nothing. A cluster of them showing up together, worth mentioning to your doctor.
This one is less visible, but it shows up on your body in ways people often don't connect to blood sugar. High glucose literally feed bacteria and fungi.
It's a better environment for them to grow, and at the same time, chronically elevated blood sugar weakens your immune response. The cells that are supposed to fight those infections aren't working at full capacity. What does this look like in practice? Recurring yeast infections, UTIs that keep coming back, and yes, this affects both men and women. Skin infections that take longer than expected to heal. Cuts or scrapes that stay red and inflamed for weeks.
The pattern is the signal. One infection, fine. The same infection coming back every few months, that's your body telling you something. Okay, I want you to do something. Put your hands together like you're about to pray.
Palms flat, fingers touching. If your palms come together easily and your fingers lie flat, that's normal. If there's a gap, if your fingers won't fully straighten, if something feels stiff or tight, that's called a positive prayer sign. And it can be an early indicator of something called diabetic stiff hand syndrome. Here's what's happening. Remember glycosylation, sugar attaching to things? It doesn't just happen to red blood cells. It happens to the proteins in your skin and tendons too.
Over time, excess blood sugar coats the soft tissue in your hands. They become thick, less flexible, less able to move through the full range of motion.
This gets misdiagnosed as arthritis sometimes. But when you look at the imaging, the joints are completely fine. It's not the joints, it's the tissue around them. Something similar can happen to the shoulder. It's called adhesive capsulitis. Most people know it as frozen shoulder. The same glycosylation process affects the connective tissue surrounding the shoulder joint. It thickens, tightens, and the result is pain and stiffness that can be severe and can last for months, sometimes years.
People with diabetes are significantly more likely to develop frozen shoulder than the general population, and it often gets treated as just musculoskeletal problem. Without anyone asking the deeper questions, if you or someone you know has been dealing with unexplained shoulder stiffness that won't resolve, it's worth getting blood sugar check. This is where things get serious, and I want to be direct about it. High blood sugar is toxic to nerves. Directly, it damages the nerves fiber themselves, and it damages the tiny blood vessel that supply those nerves with oxygen and nutrients.
The result is neuropathy, nerve damage. It usually starts in the hands and feet, numbness, tingling, a burning sensation, sometimes pain that's worse at night. Now, here's the data that stopped me when I first read it. According to the ADA's 2025 standards of care, neuropathy is present in up to 50% of people with diabetes over their lifetime. And nearly half of those people have no symptoms at the time they're diagnosed with it.
No symptom doesn't mean no damage. And this matters because of what comes next.
When you can't feel your feet, you change the way you walk without knowing it. Weight distribution shifts. Pressure goes to the wrong places. Tiny fractures develop in the bones, what researchers call microtraumas. And because there's no pain signal, people keep walking on them. The fractures don't heal, they get worse. Over time, the structure of the foot itself collapses. This is called Charcot Foot. And when you see it on an X-ray, the arch is completely gone. The foot has what's called a rocker bottom shape. The bone destruction is extensive. Here's what makes this so striking. In a published case series, researchers documented a foot going from near normal structure to severe deformity in just 10 months. 10 months! And many of these patients reported little to no pain the entire time. That's how severe the nerve damage can be.
Diabetes is the #1 cause of non-traumatic amputation in the United States. I want to sit with that for a second. Not trauma, not accidents, diabetes. Here's how it's happened.
Neuropathy means you can't feel an injury. Poor circulation means wounds don't heal well. High blood sugar means bacteria thrive. A small cut becomes an ulcer. An ulcer gets infected. The infection reaches the bone. And in severe cases, amputation is the only option left. I've read case reports of patients admitted to the ER with serious foot infections, and they had no idea anything was wrong. No pain. One case documented a patient with a foreign object embedded in the foot, completely undetected, while a severe infection had already developed around it. That's not rare. That's what advanced diabetic neuropathy looks like.
If you have diabetes or suspect you might, look at your feet every day. Check for cuts, blister, redness, swelling. Don't assume you would feel something if it was there. You might not. Last sign, and this one involves your digestive system. The same nerve damage that affects your feet can affect your nerves supplying your stomach. When those nerves are damaged, your stomach empties more slowly than it should.
This is called gastroparesis. And according to recent research, it affects an estimated 30 to 50% of people with long-standing diabetes. What does it feel like? Bloating after meals, nausea, feeling full very quickly, sometimes vomiting food hours after eating. And here's a clinical problem. When your stomach empties unpredictably, glucose absorption becomes unpredictable too, which makes blood sugar extremely difficult to manage. It creates a feedback loop that makes everything harder to control.
So, here's a practical part. If you're over 35 and haven't had any A1C tests, get one. That's a starting point.
If you notice anything in this video that applies to you, dark skin patches, stiff hands, recurring infections, unexplained fatigue, don't wait for a routine appointment. Mention it specifically. And if you want to reduce your risk, the research is pretty consistent on 4 things. High fiber foods, complex carbohydrates over simple sugars,
Both cardio and strength training, not one or the other. And if you smoke, that's the single highest leverage thing you can change. Diabetes is manageable. It's often preventable. And when it does happen, catching it early changes everything. That's what this was about.